In the ever-evolving landscape of health and science, few stories capture the public imagination quite like the tale of a drug that once promised to unlock the secrets of longevity. Metformin, a medication with a history stretching back decades, has long been hailed as a cornerstone in the treatment of type 2 diabetes. Yet, in recent years, it has also become the subject of intense speculation, hype, and controversy, not just among scientists, but among everyday people eager for a way to live longer, healthier lives. The journey of metformin from a humble glucose-lowering agent to a potential fountain of youth is a fascinating one. It's a story filled with scientific discovery, human ambition, and the occasional misstep, all of which serve as a reminder of how complex the relationship between medicine and aging truly is. It began in 2014 with a study that sent ripples through both the medical and wellness communities. Researchers observed something unexpected. Diabetic patients taking metformin were living longer than non-diabetic individuals who weren't on the drug. This finding was nothing short of shocking. After all, diabetes is a condition associated with increased risks of heart disease, kidney failure, stroke, and other life-threatening complications. The fact that these patients, despite their diagnosis, were outliving their healthy counterparts suggested something extraordinary about the drug itself. This revelation sparked a wave of excitement. Could metformin be more than just a treatment for blood sugar? Could it actually help people live longer? For those already practicing rigorous diets, intermittent fasting, and strict exercise regimens, the idea of adding a pill to extend lifespan seemed almost too good to be true. And yet, many were willing to give it a try. Soon, the supplement world took notice. Biohackers, longevity enthusiasts, and even some mainstream health professionals began recommending metformin off-label for its purported anti-aging effects. Articles, podcasts, and social media posts flooded the internet with claims that metformin could slow cellular aging, reduce inflammation, and protect against age-related diseases. The narrative grew stronger. This wasn't just a diabetes drug, it was a key to unlocking the future of human longevity. But as with any scientific claim, especially one with such high stakes, the truth proved to be far more nuanced. A few years later, a new study emerged, one that attempted to replicate the original findings. What followed was a sobering moment for those who had pinned their hopes on metformin as a miracle drug. The replication effort failed to confirm the earlier results, and upon closer inspection, significant flaws in the original research became apparent. One major issue was the way participants were selected. In the initial study, anyone who required additional medications to manage their diabetes was immediately excluded from the metformin group. This created a skewed sample, favoring only those whose diabetes was well controlled without the need for multiple drugs. Naturally, this group would have better health outcomes, not necessarily because of metformin, but because they were inherently healthier to begin with. Even more troubling was the handling of the control group. Participants who developed diabetes during the course of the study were removed entirely. As we know, the risk of developing diabetes increases with age, so this exclusion further biased the data in favor of the metformin group. In essence, the original study may have compared the most resilient diabetics with people who never developed diabetes at all, an apples to oranges comparison. Once these biases were corrected, the results aligned with what most experts had always expected. Non-diabetic individuals tend to live longer than those with diabetes. The supposed longevity boost attributed to metformin simply disappeared. This revelation didn't just dampen the enthusiasm around metformin, it also served as a powerful lesson in the importance of rigorous scientific methodology. In the rush to uncover the next big breakthrough, it's easy to overlook subtle but critical details that can completely change the interpretation of data. Science, after all, is not just about making discoveries, it's about verifying them. Despite the disappointment, the conversation around metformin didn't end there. Instead, it evolved into a deeper exploration of how the drug actually works within the body. And here, another surprising twist awaited. For years, the prevailing understanding of metformin's mechanism was based on a model that assumed it acted primarily in muscle cells. According to this theory, metformin inhibited a key component of the mitochondria known as complex I, thereby reducing energy production and forcing cells to take up more glucose from the bloodstream. This process was thought to lower blood sugar levels by increasing lactate production and creating a kind of metabolic traffic jam in the cell. But this widely accepted explanation was built on a flawed assumption that metformin could actually enter muscle cells in the first place. And then came a critical realization, one that challenged everything previously believed. The organic cation transporter, the molecular gate that allows metformin to cross cell membranes, is not present in muscle cells. This means that, contrary to popular belief, metformin does not enter muscle tissue at all. The entire premise of metformin acting in muscle cells was based on a misunderstanding of where the drug actually goes. So where does it go? The answer lies in the liver. Unlike muscle cells, liver cells are equipped with the necessary transporters to absorb metformin. Once inside the liver, the drug exerts its primary effect by inhibiting gluconeogenesis, the process by which the liver produces glucose. This is a crucial function in the management of type 2 diabetes, as excessive glucose production by the liver is a hallmark of the disease. But this also explains why metformin doesn't affect muscle cells the way many had assumed. The elevated lactate levels seen in people taking the drug aren't the result of mitochondrial dysfunction in muscles. Instead, they come from the liver, where the breakdown of glucose into lactate increases due to metformin's influence. This insight not only corrects a long-standing misconception but also highlights the complexity of how drugs interact with different parts of the body. With this new understanding in hand, the question remains, should metformin still be considered a candidate for longevity? The answer isn't simple. On one hand, metformin is one of the safest and most cost-effective drugs available for managing type 2 diabetes. Its benefits in lowering blood sugar, improving insulin sensitivity, and reducing the risk of cardiovascular events are well documented. These effects alone make it an invaluable tool in the treatment of diabetes. On the other hand, the evidence for metformin as an anti-aging drug is far less clear. While there are ongoing studies exploring its potential to delay aging and reduce the incidence of age-related diseases, no definitive conclusions have been reached. One large-scale clinical trial, known as TAME, targeting aging with metformin, is currently underway and aims to provide the most comprehensive data to date. Until its results are published, however, the role of metformin in longevity remains uncertain. There are also important safety considerations to keep in mind. Although generally well tolerated, metformin can cause side effects such as gastrointestinal discomfort, vitamin B12 deficiency, and, in rare cases, lactic acidosis, a potentially life-threatening condition characterized by dangerously high levels of lactic acid in the blood. These risks are particularly relevant for individuals with impaired kidney function or other underlying health conditions. Moreover, the decision to take metformin for longevity purposes raises ethical and philosophical questions. If the drug is found to extend lifespan, who gets access to it? Should it be limited to those with diagnosed conditions, or should it be made available to everyone seeking to live longer? And if it turns out to have no real effect on aging, will the widespread use of the drug lead to unnecessary side effects and healthcare costs? These are difficult questions with no easy answers. But they underscore the need for careful, evidence-based decision-making when it comes to using medications for purposes beyond their intended use. Still, the allure of metformin as a longevity drug persists. Some continue to believe in its potential, citing anecdotal reports and preliminary studies suggesting that it may offer protective effects against cancer, neurodegenerative diseases, and other age-related conditions. Others remain skeptical, arguing that the burden of proof is not yet met. What is clear, however, is that metformin represents a fascinating intersection of medicine, science, and human desire. It is a drug that has saved countless lives by helping to manage diabetes, and it continues to spark curiosity about the nature of aging itself. Whether or not it ultimately proves to be a miracle drug for longevity, its story serves as a reminder of how much we still have to learn about the human body and the complex systems that govern our health. As researchers continue to investigate the mechanisms of metformin and its potential applications, one thing is certain: the search for ways to live longer, healthier lives will remain one of the most compelling quests of our time. And in that pursuit, every new discovery, whether it confirms our expectations or challenges them, brings us one step closer to the truth. And there you have it, the full, fascinating story of metformin, a drug that started as a simple treatment for diabetes but became the center of one of the most debated topics in modern longevity science. From early excitement to scientific correction, from misunderstood mechanisms to clearer truths, this journey reminds us that in science, the path to knowledge is rarely a straight line. So what's the takeaway? If you're someone with type 2 diabetes or insulin resistance, metformin remains one of the safest and most effective tools available. It's been helping people manage their condition for decades, and its benefits are well supported by research. But if you're healthy and considering metformin just to live longer, the current evidence isn't strong enough to justify it. The TAME trial is still underway, and until we see its results, it's wise to wait and let the data speak for itself. More importantly, this story teaches us a valuable lesson: even when something sounds too good to be true, it often is. Scientific progress requires patience, critical thinking, and a willingness to question what we think we know. And above all, it demands that we separate hype from hard facts. If you found this video informative, make sure to like, subscribe, and hit that notification bell so you don't miss the next deep dive into the health and wellness. Thanks for watching.